and lower lips. So in addition to that, the eyes are very distinctive. You may have a double row of eyelashes, and they look like they've got very full, they've got a long philtrum. These are other children who have got the same sort of condition. And if you see an older child that is reminiscent of this particular condition, please remember it's possible to have milder Cornelia de Lange syndrome, and about a third of these conditions can have congenital heart disease of various types. And this is an older child at the bottom, the front and the side view. And most of them have this characteristic upturned nose, which is easier to recognize even if the other features are more subtle. And they've found increasingly that not only do you find the gene responsible for it to be located in one, this is the importance of having the pathway. The moment they found the gene, for some of the cases, they knew that other genes in the same pathway accounted for some of the other Cornelia de Lange's. So this is in the cohescent pathway, and I think together the 5 genes have been found so far for this, accounting for about 90% of all cases that are clinically diagnosed. This is another syndrome, and this is a little boy. This is an interesting story because this was a child who was brought under 3 months of age with hepatosplenomegaly, and somebody had suspected a storage disorder. So now storage disorders don't have large spleens and livers at this young age. So you have to start thinking a little bit out. So bone marrow was done, as is the protocol for most things, and they found that the child had juvenile myelomonocytic leukemia. And this was the face of the child to start off with, as the child grew older. So when you look up juvenile myelomonocytic leukemia, quite a rare type of leukemia, and one of the associations is Noonan syndrome. So this is a subtle Noonan syndrome who had, what I'm trying to show in the other figure, is that most of the Noonans that we have seen have got these posteriorly rotated ears. We always talk about them being loosely a male turners with neck webbing, which we don't see very often. What we see is this posteriorly rotated ears, slightly on the smaller side. Almost all of these kids leukemia is very, very unusual, but most of these kids have got congenital heart disease in about half of them. It's either pulmonary stenosis, or if you watch them grow older, they tend to have cardiomyopathy, and both of these can be managed. Why was it important to know that this juvenile myelomonocytic leukemia was associated with Noonans here? Because unlike the other types of similar leukemia, these children do really well, and they do not really succumb to the disease. So just by making a clear face diagnosis, we were able to look at this. And if you are finding this difficult because this is the face of Noonan syndrome at various ages. As you look at the face, what's common to all of them is they usually have this big eyes with large eyelids, hooded on one side or the other, or with overt ptosis. They also have the upturned nose, so there is a little bit of an overlap between this and the Williams face, but they also have this pointed chin. Most of them have curly hair out of proportion to the family straight hair, even if they have, and they are associated with webbing of the neck, if you can get as far as that, and the look persists through life. So if you go a little bit lower down, there are other features, but things that are marked out in blue are the things that you can see in utero when you're trying to diagnose it. So if you see cystic hygroma with a normal chromosome, prenatally done, please think Noonan syndrome. Now, Noonan syndrome is a single gene condition. If one person has it, there's a 50% chance that the child will have it, and there's a huge pathway which accounts for a lot of things. This is the RAS-MAP kinase pathway, and many syndromes are associated with it, but one of the risks is malignancy risk. Now, another condition that causes congenital heart disease and a face in it, this is 2 sides of the same child's face, and this is Golden heart syndrome, or auriculovertebral spectrum. So this is a sporadic condition under in most cases, and they're associated with extra skin tags, which extends in a line from the edge of the mouth to the start of the ear tragus. And you can have multiple tags. There's usually facial asymmetry. If you take a cervical spine X-ray, you might see abnormalities in the cervical spine, and 50% of these children can have congenital heart disease. They may or may not have eye abnormalities, and they usually have stretching of the mouth on the same side as the asymmetry of face, which is known as macrostomia. Now, this is another child, and very unusually, the mother also had a mild manifestation. She had a dysplastic ear, and she did not know that this was the mildest manifestation of this particular condition. In fact, for 6 years that she had been married, her hairstyle covered this, so even her husband didn't know that she had this abnormality, and she has also got the ear pierced in case she was regarded as abnormal. So child can be born with a wider spectrum than the parent who is mildly affected, and each time there is an affected parent, there's a 50% offspring risk. So majority of golden hearts have got a low spectrum of recurrence, but if you have a parent that's affected, it may be 50%. These are other children who have got different manifestations, and what you can see in the child that's crying is what we call an asymmetric crying facies. So this is not facial palsy, only the lower lip is twisted to one side, and this is because of a muscle palsy on this side, which is sometimes associated with the spectrum of golden hair syndrome. So the classical manifestations in the face, what you can see in this child who's really, really unhappy to have his picture taken, was this epibulbar dermoid, which is pathognomonic of this particular condition. So if you see an epibulbar dermoid, then you know that you're dealing with a condition that is in the golden hair spectrum. They usually have what we spoke about, facial asymmetry on both sides. Ears may be dysplastic. You can have macrostomia. You have congenital heart disease. You can have cervical abnormality, and we spoke about the recurrence risks. Okay. After you think you know everything about recognizing faces, you're still stumped sometimes. And all these children have the same condition. And this is my last slide. So what is this? Yes, this is Down syndrome. Each of these children has got full trisomy 21. And you will agree with me that this is really difficult. It's not once or twice. You do find difficulty sometimes of recognizing one of the commonest conditions that is associated with congenital heart disease. So always look out for other manifestations such as the single palmar creases, such as the white sandal gaps, such as the nuchal translucency. And sometimes that will help you make the diagnosis beyond the face. And thank you for that.
Very interesting, and love to see those pictures. Of course, I know they're very unfortunate children, but thank you for your collection. So after this we have lunch, and then we assemble back for the next session. So any okay. So you can have questions during the lunch. I'm so sorry. It's eating up the lunch basically, but thank you so much. Daisy, do you have the presentation ceremony? Sure.
Manish Parekh sir to present to our next speaker, Dr. Manisha Agarwal. Please request Suresh Verma to present the memento as a token of recognition to Dr. Meenakshi Bhatt. Please request Dr. Meenakshi Bhatt ma'am to present token of appreciation memento to our chairpersons. Dr. Manish Parekh sir. To Dr. Pratibha Singh ma'am. Verma, sir. Thank you all speakers for the wonderful talk. Now we break for lunch and we soon gather here for the next session. Thank you.